Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Spine surgery might be the option for you if you have debilitating back pain, but this is a major procedure and it's extremely important to talk with your doctor about the possible complications that you're aware of your risk when you're considering surgery. Now joining us today to discuss everything from infections to failed back surgery syndrome is one of our favorites, Dr. Gosha Busavanik, spine surgeon with Baptist Health South Florida. Welcome back, doctor. It's great to have you.
Thank you, Kathy. Great to be on air with you.
Okay, we're talking the complications, and these are common. They can happen. So what are some of the complications from surgery?
So, surgery in general, the common and the feared one is infection.
Right.
And we'll talk hopefully in detail about how to address it and how to minimize that risk. Spine surgery itself has its own unique set of complications. Disc herniations sometimes re-herniate. Fusions sometimes don't take, and these patients sometimes need to have more surgery. Hardware sometimes is placed badly, and sometimes the surgery doesn't really match the patient. So it's important to be real studious before you make the diagnosis, but it's even more important once there's a complication to really address it, figure out exactly what the problem is, and get the patient back on track.
Is this a common concern that a lot of your patients may have, maybe before going into surgery?
Oh, that's a universal concern. It's the most important point of discussion before surgery, and it's something that I like to discuss with patients multiple times. I say to patients, we're going to battle together. And you sort of say it facetiously, you sort of say it as a joke, but the reality is that
It's true.
when you go to surgery, the patient's going to be the one that's injured.
Right.
And is it more or is it less injured? Depends on a lot of things. And if a complication happens, it's important to make sure that the surgeon sort of helps the patient get through it.